Let's walk the path beyond ego together, because once you've accepted that you can heal from your suffering, the natural question is, how long does it take to heal from my trauma? Well, of course, it depends upon two primary factors: the severity of your trauma and how long ago it was, how many years have compacted around that agonizing experience, how many behaviors have symptomatically emerged in regards to that experience, and number two, the type of therapy. So, of course, in regards to the trauma itself, there is a spectrum of differentiation between something like alcohol abuse or drug abuse in an adult relationship in response to emotional neglect from a romantic partner, and something like dangerous and degrading sexual behavior, which began in adolescence because of an experience of violation. They might look like the same form of destructive behavior in essence when you meet someone as an adult, but the origins are very different. When it comes to complex cases and complex traumas, we need a therapy which looks deeper. And that's where transpersonal psychotherapy comes in, which is something that very few people have heard of. I doubt that your national health service provider or private medical insurance is going to offer transpersonal psychotherapy if you're going in with anxiety, depression, or even something like suicidal ideation. But something which I've come to realize about myself in my one-to-one work and one-to-one sessions is that although I am not a transpersonal psychologist by training, very transparent that I'm not professionally trained in any particular therapeutic or psychological field, I am a synthesizer, I am a full spectrum integrator, kind of researcher, practical action type of man. I do draw an incredible amount of inspiration from the principles of transpersonal psychotherapy, which I'm going to bring forwards in this video, namely the 5 principles of therapy. But first, let's define what transpersonal psychology is. No better place to do it than this marvelous book, Paths Beyond Ego, which is an essay collection with 46 essays, all relating to the field of transpersonal psychology. And as you'll see from the marginalia in the quote which I'm about to read out, this was an impactful book for me to read when I first encountered the field, maybe about 3 years ago. You can see right there, I clearly resonated with the language and the essence and style of the transpersonal psychologist. But let's define it first from this wonderful essay number 25 in the collection, Healing and Wholeness, Transpersonal Psychotherapy by Francis Vaughan, who's a wonderful writer in the space. I've got a few of their books. Defined and quoted: transpersonal psychotherapy is a healing endeavor that aims at the integration of physical, emotional, mental, and spiritual aspects of well-being. You've heard this before, right? A little bit further on. In transpersonal therapy, consciousness is both the instrument and the object of change. The work aims not only at changing behavior and the contents of consciousness, but also at developing awareness of consciousness itself and the context of experience. Ideally, a transpersonal approach aims at awakening from the consensus trance that perpetuates illusion. This is where we're getting more mystical, and this is where we're getting more cognitive and intuitive. Continues on to the next page. Really good quote here. Transpersonal psychotherapy does not focus exclusively on problem solving per se. Like the fisherman who teaches the hungry person how to fish rather than simply providing a fish, the therapist encourages the client to develop a variety of inner resources and problem solving skills. The therapist also recognizes, this is crucial, that there is no one method or technique that will necessarily result in healing for everyone. If you watched some of my videos before, if this is one of the many episodes in Inner Work Essentials that I'm glad that you've received, then you'll see how there are similarities between this approach and probably the energy you get off me. I'm very much someone who's about authenticity and interdependence rather than codependence or game playing, especially in my one-to-one work, which I'm going to bring in a little bit more in this episode for context and relevance, especially as we get into the 5 defining principles of psychotherapy as it relates to integrating trauma. What I love about this description overall is that we have such a holistic baseline: physical, emotional, intellectual, and spiritual. This is very much the classic holistic 4-word, 4-punch combination when it comes to integration work. You've heard it many times before. But what does it actually mean to work on those levels? Well, we're going to explore it in a moment. In fact, it's probably relevant to read the second quote from a different contributor in regards to the 5 principles, and then we'll weave it all back through with some personal stories, and I'll give you an idea of what I've learned from my one-to-one work as a facilitator and some of the things that you could expect from working with a transpersonal psychotherapist who's not me necessarily, but I've also had those experiences that match up to some of what I'm about to share with you. But I invite your attention anyway. So, what is transpersonal psychotherapy? What are the 5 main defining attributes of this form of therapeutic intervention compared to something like cognitive behavioral therapy, or even Jungian therapy, or a somatic approach, or any nameable approach towards trauma healing? Let me read it for you. I suggest, quote, transpersonal psychotherapy affirms 1. The need for healing growth on all levels of the spectrum of identity, egoic, existential, and transpersonal. 2. The therapist's unfolding awareness of the self, or deep center of being, and his or her spiritual perspective on life as central to the therapeutic process. 3. The process of awakening from a lesser to a greater identity. 4. The healing, restorative nature of inner awareness and intuition. And 5. The transformative potential in the therapeutic relationship, not only for the client, but for the therapist as well. Marvelous book. I truly recommend you read this. It's such a classic. I think it was in 1990 printing, and really introduces you to the whole field in a way where you'll get many launch points with different contributors, and you'll go, I actually want to read some Ken Wilber. I actually want to read some Stan Grof. I actually want to read some Francis Vaughan. You'll find these natural curiosity points if you're liking what you're hearing in this video so far. I'm not going to stick play by play to those 5 principles. I'm going to allow myself to riff from a more soulful, experiential perspective. In a nutshell, transpersonal psychotherapy, as I understand it, is about orienting in the primary self energy, or some would say soulful energy, which transcends egoic limitations, but also includes them. This is a very integral philosophy idea that the higher self is the larger structure, which encompasses the egoic structure. But if we're doing true therapeutic work, then we have to be aware that moving to that higher reality, so to speak, or at least that higher perspective of identity, does require an awareness of not bypassing from lesser to greater, but evolving from lesser to greater. What this means in simple language is that in transpersonal psychotherapy, we're doing the work to heal the ego, not destroy the ego. It's one of the most mistaken ideas that really floats around in common language, that ego gets in the way, or that a person needs to leave their ego aside, or in Buddhist meditation, or at least in a popular understanding of Buddhist meditation, that we need to kill the ego. But the path beyond ego, this path from egoic identity construct to greater self or soulful identity construct, is not a bypassing, and it's not a dissolving. If I were to turn this around for you and make it a 3-dimensional object, imagine what would happen if you tried to orient yourself in a transpersonal identity in your higher self, but you dissolved the core, which is your ego identity. You'd be hollow. You'd have a sense of floatiness and airiness, and even this metaphor doesn't quite work because we can invert it. Imagine if the ego is the shell from a different perspective. So the transpersonal self is the core, and your ego is the shell. Sure, you can dissolve that shell, and you can kill your ego, and you can achieve satori and enlightenment-oriented bliss and wonder, but you will not be able to go to the grocery store and interact with humans in an everyday way, or look after your body in a way that actually sustains you for multiple decades if you don't have a healthy egoic construct. I've heard stories, pretty powerful stories, of people who have hosted meditation retreats or been on long meditation retreats, and they get to a point where they've gone so deep into the space that their ego has temporarily dissolved. They've gone into a psychic emergence or a spiritual opening, and they can no longer remember what it means to brush their teeth and eat regular meals and look after their body and shower and groom and be polite to other people. They can sometimes become cold. They can sometimes have this feeling, maybe I'll demonstrate it, where they're like a bit spacey, and they're a little bit, their eyes go, and they're a bit shocked by the world, but they're seeing a lot, and you're like, wow, they're so mystical, they're so magical, and even tapping into it, I'm moving around. Where has the ground gone? The ground has disappeared from beneath their feet. Transpersonal psychotherapy works in this realm of finding a way to link between ego and higher self. I'm going to stay with that phrase, higher self. Hopefully we can set aside the nuances of what that term means for now. What we're trying to do in that space is heal the ego to integrate it as part of something which is greater. And the way that we do that is by working with consciousness as both the tool and the instrument and the process. So what we mean here is that we have an awareness in transpersonal psychotherapy that consciousness is the quickening force, or it's the agent of change which allows for deeper subconscious healing processes. I'll unpack that a little bit. When it comes to something like repressed childhood trauma, let's give a specific example. I'll bring forward an example that I work with quite often in my one-to-one work. So this is the example, unfortunately, of someone, trigger warning, who has experienced sexual violation during their childhood or adolescence. For men or women who have gone through this experience, there are elements which are conscious and unconscious, depending on the age at which the abuse occurred. There could be a conscious memory, or maybe a conscious impression on the body, maybe pain in the womb or a difficult time during menstruation, or maybe tightness or premature ejaculation, or a whole variety of somatic complaints or somatic difficulties, coupled with a conscious awareness of certain images and certain flashbacks. But there's so much more that exists in the unconscious, and crucially when it comes to the transpersonal approach towards healing, we're trying to find the way to peel back the layers like the ego and the higher self, the layers upon layers between conscious and unconscious, and the threads in between. Very few people, until they've gone into a genuinely transformative healing container, even if they're not suffering something like a horrible violation in their childhood, will be able to peel back the layers with clarity of why their present-day symptoms or behaviors or habits or neuroses link back to something which is maybe 20 or 30 years in the past. There's an awareness that childhood might have something to do with that pain, but there's not the ability to cross or bridge or even identify the unconscious structures which lay dormant inside of our bodies and minds. The work of transpersonal psychotherapy is shining a spotlight, or lighting a candle at the very least, in that darkness of the soul, to try and bring forwards a quickening of consciousness, bring forwards an illuminated opening where you remember. And not only remember, but also be that purifying fire which dispels the cobwebs and burns through the space which is burning you. Getting very poetic with the language, you can tell that I'm already getting into that energy right there. There's many men and women that I've worked with where we've gone through these issues, and it's something which is very difficult to describe without naming particulars. In fact, actually, you'll notice if you scroll down on this video, I've made an effort for the first time in this series to properly disclose what it means to work with me and what that looks like in terms of session structure and my fees for working with me. I put it all down there in the pinned comment. Spent about 5 or 6 hours trying to write that in a way which captures the complexity of the work in a way which is publicly digestible. But even there I struggled to try and understand just what it means to communicate that ineffable conscious-unconscious process where we're also working not only in conscious and unconscious realms, but physical, emotional, spiritual, and mental realms. Physical, conscious, physical, unconscious, emotional conscious, emotional unconscious. And then if you truly want to get holistic and integral, how do we draw threads between different layers? You have to imagine geometry to even get an idea of what's going on. A physical unconscious might be linked to a spiritually conscious idea. A spiritually conscious idea could be linked to a mentally unconscious process which is built upon a foundation of a physically unconscious process. Transpersonal psychotherapy and the paths beyond ego require us to look for those hidden connections and walk that path beyond the ego, not in a sense that we're trying to leave the ego behind, but that we're trying to see the webs which weave around our certain core identity constructs. This is where parts work is really important. This is where something like interacting with our subpersonalities and understanding archetypal influences becomes of grave significance if we're trying to resolve something which is tragic in our past. We can see how certain archetypal coping mechanisms, for example, let's go with the sexual abuse example. This is something which is incredibly common. Not sexual abuse, hopefully, but the pattern or the response towards sexual abuse. Two main threads that I see. We'll go with women to make it simple. Different story with men sometimes. A woman who's endured a sexual abuse during childhood, adolescence, or even an adult relationship typically will gravitate towards one side of the spectrum or the other. Either they will shut down and they will numb and they will dissociate and they will become distant from the world of dating and romantic connection. Or they will overcompensate by becoming a femme fatale, seductress, vampiric sort of energy. These are the two general patterns, but it gets more complex. It's unfortunately a tragically common complex for someone who's coping with sexual dysfunction or sexual challenge to have something like a femme fatale personality as a mental construct or even an emotional construct at that surface level of consciousness. But if you peel back the layers, the physical unconscious is actually numbed out. This is the woman who can be full of life, and she's got her beauty, and she can smolder, and she can hook you in. But then when she's actually in the bedroom, she can't feel very much, and she definitely can't orgasm freely with a loving heart. The opposite also occurs. Someone who's externally very closed off from the world and has the conscious appearance of being completely unavailable and numb, they might surprise themselves that when they get into a truly safe, loving, romantic situation, they have some of the most heart-based opening experiences of any human. There's all kinds of complexities. We are not simple creatures. Transpersonal psychotherapy, in my honest opinion, is one of the best therapies out there for people who are complex. People who know that they have multiple parts, that they've endured a lot, and they're seeking to go towards a place where they can release some of that baggage and also find a way to connect the threads, which have always been there, but have elements of darkness between them. This is the spotlight shining into that darkness, or the candle, or the bonfire, or occasionally just the flare in the dark, which flashes the roads between, which creates those connections so that we can feel more connected. We can feel more integrated. This is what it means to heal fragmentation in a very poetic but hopefully still trackable sense. Transpersonal psychotherapy really could be one of your best friends if you're looking to get to that next level of inner work. It's something which I draw upon very much for myself, and actually I will finish with one final point because I promised myself I would not talk just about the books, but actually talk about my own private practice more openly. Something which I love about the transpersonal approach, it's also a humanistic approach, it's a humanistic psychology approach, is what I experience when I'm doing a 4-month mentorship with someone, is that there's me as an individual, and there's them as an individual, and there's all the complexities inside of us, and there's various teachings that occur in that very ordinary space. But a transpersonal perspective of the therapeutic relationship is that that very connection itself is a healing factor. there's almost a third consciousness that emerges in that shared space of meeting week after week and having a mutual intention to do the inner work together. That's what makes it so enlivening and honestly very nourishing, even though it's often very difficult, because you know you're doing something which is real. You can feel the tangible presence of that space between you and how that grows into something which is more than the two of you put together. And it's that which almost gives back to us. It's really quite special. Of course, it takes a very particular type of person to endure that pressure and those moments of being plunged into the darkness and being weighed upon by all of the shadow elements which then come to light in that spaciousness between. But something like transpersonal psychotherapy is definitely well equipped when accompanied with things like conventional trauma therapy, somatic release, even things like cognitive behavioral therapy or the Jungian approaches or another dozen therapies that I could list. It's one of the best ones out there for someone who, like yourself, is still watching to this point on a very particular type of video about integrating trauma. If you're interested in this kind of work, I'm going to hold up this book, but I'm going to put it back down because I'm not going to avoid making a direct invitation. If you're interested in this kind of work, it's what I offer. I put a pinned comment down in this video, which is my best attempt to try and clarify who I am, who I'm for, and what I would expect from you if we were to work together. And I'll also hold up this book because you also don't need me as any particular one person. My whole ethos with this channel is that with a bit of attention and a bit of consistency and the right resources, you can self-heal to a considerable degree in just 1 year of focused inner work. 52 episodes in the series, 52 books being held up, 1 book per week if you're committed. That's my genuine invitation. If you want a little bit more, people like myself or other very gifted, very beautiful therapeutic supports, there's so many of them out there. I'm blessed at this stage of my journey to have different connections to other professionals, and we all share this energy of wanting to do better in the world. We are out here, and you're out there. We're all coming together, but in the meantime, please do, at risk of redundancy and repetition, please do read the books I recommend. They are recommended for a reason, and I guarantee that it will help you to walk that path beyond ego and see how you can integrate yourself on your own time for very little money, a lot of time and a lot of energy, but you can get there yourself. In the next episode of Inner Work Essentials, I'm going to be taking what seems like a bit of an unrelated U-turn, but we're going to be talking about one of the major pitfalls to this work of integrating and unintegrating and dissolving, and that's New Age delusion. We're going to be talking about one of my favorite books that I've ever read. Actually, I will say, it's the most important book I own in my library. It's over there, and I'll see you over there.